Welcome to USMLE Step 1 Immunology, Spleen and Diseases. This video will cover the spleen from the first aid book. There will be USMLE questions associated with testing knowledge and memory. If you have not done so, please click like and subscribe. Thank you. Now, let's start. The spleen is located in the lower upper quadrant of the abdomen, anterolateral to the left kidney. And it's protected by the 9th to 11th ribs. A protective capsule envelops the spleen. The capsule serves to maintain the structural integrity of the spleen and helps regulate blood flow, as it contracts during times of stress or injury to release stored blood into circulation, aiding in the body's response to various physiological challenges. Trabecular. The spleen is a vital organ within the human body that is responsible for a variety of functions, and it contains a structural network known as trabeculae. Trabeculae are thin fibrous bands or cords of connective tissue that crisscross through the spleen, providing support and forming a framework within the organ. The functions of the trabeculae within the spleen include structural support. Trabeculae help maintain the shape and integrity of the spleen. They create a scaffolding that holds the splenic tissue in place, preventing it from collapsing or distorting. 2. Blood filtering. The spleen acts as a blood filter, and the trabecular network plays a role in this process. Blood flows through the spleen sinusoids, where immune cells and macrophages located along the trabeculae remove old or damaged red blood cells, pathogens, and cellular debris from the bloodstream. 3. Red blood cell storage. Trabeculae also contribute to the spleen's ability to store a reservoir of healthy red blood cells. In times of increased demand, such as during periods of physical activity or blood loss, the spleen can release stored red blood cells into circulation, helping to maintain proper oxygen levels in the body. 4. Immune function. Within the spleen, the trabecular network provides a framework for immune cells, such as lymphocytes, to interact and respond to foreign invaders like bacteria or viruses. This enhances the organ's role in immune surveillance and defense. Red pulp. The red pulp is a critical component of the spleen, one of the body's primary lymphoid organs. It constitutes a significant portion of the spleen's tissue and plays essential roles in various functions related to blood filtration and immune system support. Functions of the red pulp in the spleen include 1. Blood filtration. The red pulp acts as a blood filter, primarily responsible for the removal of old, damaged, or abnormal red blood cells, erythrocytes, from the circulation. This function helps maintain the quality of red blood cells in the bloodstream, ensuring that only healthy ones continue to circulate. 2. Red blood cell storage. The red pulp serves as a reservoir for storing a reserve of healthy red blood cells. In situations of increased demand, such as during physical exertion or in response to blood loss, the spleen can release stored red blood cells into circulation, aiding in maintaining proper oxygen levels in the body. 3. Immune response. Within the red pulp, there are areas known as splenic cords and splenic sinuses, which contain various immune cells, including macrophages and lymphocytes. These immune cells play a role in detecting and responding to pathogens, such as bacteria or viruses, that may be present in the blood. 4. Removal of cellular debris. Besides red blood cells, the red pulp also helps clear cellular debris, damaged platelets, and other waste products from the bloodstream. This function contributes to overall blood quality and the body's ability to dispose of waste materials. Remember, red pulp is associated with red blood cells. Sinusoids in the spleen are specialized blood vessels that allow for the filtration and interaction of blood with immune cells, contributing to the spleen's vital roles in blood filtration and immune system support. The reticular fibrous framework of the spleen forms a structural network that provides support to the organ and helps organize its tissue, facilitating functions such as blood filtration and immune responses. Open circulation in the spleen refers to the unique way in which blood flows through this organ. In the spleen's open circulation, 1. Blood enters the spleen through the splenic artery, carrying oxygenated blood and various components, including red and white blood cells. 2. Within the spleen, the blood is released into open spaces called sinuses instead of flowing through traditional capillaries. 3. In the sinuses, immune cells and macrophages associated with the spleen's reticular framework interact with the blood to remove old or damaged red blood cells, pathogens, and cellular debris. 4. After this interaction, the blood exits the spleen through the splenic vein, having undergone filtration and immune surveillance. And 5. The cleaned and filtered blood returns to the systemic circulation for distribution throughout the body. The closed circulation in most other organs, where blood travels through a closed network of arteries, capillaries, and veins, the spleen has an open circulation system. The pulp veins in the spleen are a network of small blood vessels found within the red pulp, which is one of the two main regions of the spleen, the other being the white pulp. These pulp veins play a crucial role in the spleen's functions, particularly in blood filtration and the removal of aged or damaged red blood cells. Functions of pulp veins in the spleen include 1. Blood filtration. Pulp veins receive blood from the splenic sinusoids, which have already interacted with immune cells and macrophages. Pulp veins continue the filtration process by allowing the passage of healthy red blood cells while trapping and phagocytizing, engulfing, damaged or abnormal red blood cells and other cellular debris. 2. Red blood cell recycling. Pulp veins play a key role in recycling iron and other essential components from the engulfed red blood cells. The iron is then transported back to the bone marrow to support the production of new red blood cells. 3. Immune responses. Pulp veins are in close proximity to immune cells in the red pulp, facilitating communication and interactions between immune cells and blood components. This is important for the spleen's role in immune surveillance and response to infections. The spleen is supplied with blood by two main types of vessels, arteries and veins. These blood vessels play crucial roles in maintaining the spleen's functions, including blood filtration and immune responses. Splenic arteries. 1. The splenic arteries are responsible for delivering oxygenated blood to the spleen. They arise from the celiac artery, which is a branch of the abdominal aorta. As the splenic arteries enter the spleen, they divide into smaller branches, forming a network of arterial vessels within the organ. These arterial vessels further branch into arterioles, ultimately leading to the formation of the splenic sinusoids within the red pulp of the spleen. The arterial blood carries oxygen and nutrients to the spleen cells and tissues, including immune cells and macrophages that play a role in the organ's functions. Splenic veins. After the blood has circulated through the spleen's sinusoids and undergone filtration and immune surveillance, it exits the spleen through the splenic veins. The splenic veins converge to form the splenic vein, which carries the filtered and modified blood away from the spleen. The splenic vein eventually merges with the superior mesenteric vein to form the portal vein, which transports blood to the liver for further processing and detoxification. From the liver, the blood re-enters the systemic circulation via the hepatic veins and the inferior vena cava. The white pulp is one of the two main regions of tissue within the spleen, with the other being the red pulp. The white pulp is primarily composed of lymphoid tissue and is responsible for the immune functions of the spleen. Immune function. The white pulp serves as the immune surveillance and response center of the spleen. It contains clusters of lymphocytes, including B cells and T cells, which are essential components of the adaptive immune system. These lymphocytes play a critical role in recognizing and responding to pathogens, such as bacteria and viruses, as well as in initiating immune responses to foreign invaders. Lymphoid follicles. The white pulp consists of structures called lymphoid follicles, which are rich in B cells. These follicles are organized around central arteries that penetrate the white pulp. Within these follicles, B cells can proliferate, differentiate into plasma cells, and produce antibodies, which are important for humoral immunity. T cell zones. In addition to B cell-rich areas, the white pulp contains regions known as T cell zones called periarteriolar lymphatic sheath. These areas are primarily populated by T cells, which are crucial for cell-mediated immune responses and for coordinating immune reactions. The marginal zone is a specialized area found within the spleen, specifically at the interface between the white pulp and the red pulp. This region plays an important role in the spleen's immune functions and acts as a bridge between the two primary functional zones of the spleen. The marginal zone contains macrophages and specialized B cells. Site where antigen-presenting cells capture bloodborne antigens for recognition by lymphocytes. Located between red pulp and white pulp, the term mantle zone is more commonly associated with lymphoid tissue organization in lymph nodes and lymphoid organs such as the spleen. However, it is important to note that the mantle zone is not a specific anatomical region within the spleen itself. Instead, it is primarily used to describe the organization of lymphoid follicles within lymph nodes. In lymph nodes and similar lymphoid structures, the mantle zone refers to the outer region of a lymphoid follicle, which is primarily composed of B cells. Germinal center. The mantle zone surrounds the central germinal center, where B cells undergo proliferation, differentiation, and antibody production in response to antigen stimulation. Splenic dysfunction, whether due to post-splenectomy, surgical removal of the spleen, or conditions like sickle cell disease, autosplenectomy, can lead to a cascade of immunological consequences. One significant effect is the development of IgM deficiency, where the spleen's impaired function compromises the production of immunoglobulin M antibodies. As a result, the ability to effectively combat infections is compromised, leaving individuals more susceptible to bacterial infections, particularly encapsulated bacteria. Additionally, the reduced function of the spleen hampers the clearance of immune complexes and debris, leading to decreased complement activation and lower levels of C3b, an essential component of the complement system. This immunological cascade underscores the vital role of the spleen in maintaining a robust immune response and highlights the importance of addressing potential complications arising from splenic dysfunction. Opsonization is a crucial immune process that involves the tagging of pathogens, such as encapsulated bacteria, by opsonins, such as antibodies and complement proteins, to enhance their recognition and engulfment by immune cells like macrophages and neutrophils. In the context of the spleen, which plays a vital role in filtering the blood and removing pathogens, opsonization is of particular significance. When the spleen's function is compromised, either due to post-splenectomy or conditions like sickle cell disease, opsonization becomes less effective. This leads to a decreased ability to effectively mark and remove encapsulated organisms from the bloodstream. As a result, individuals with splenic dysfunction become more susceptible to infections caused by encapsulated bacteria, which can include pathogens like Streptococcus pneumoniae, Haemophilus influenza, and Neisseria meningitis. This increased susceptibility underscores the critical role of the spleen in the body's defense against these specific types of pathogens and highlights the importance of monitoring and managing splenic dysfunction to reduce the risk of such infections. Vaccinating patients undergoing splenectomy or those with splenic dysfunction against encapsulated organisms, such as pneumococci, Haemophilus influenza type B, Hib, and meningococci, is a crucial preventive measure to reduce their risk of severe bacterial infections. The spleen plays a vital role in the immune system's defense against these bacteria, so when splenic function is compromised, vaccination becomes even more critical. Post-splenectomy findings refer to the physiological changes and abnormalities that may occur after the surgical removal of the spleen, splenectomy. The spleen plays several vital roles in the body, including blood filtration, immune responses, and platelet regulation. When the spleen is removed, either partially or entirely, certain characteristic findings can emerge. Howell-Jolly bodies, nuclear remnants. Howell-Jolly bodies are small, round, dark staining remnants of cell nuclei that are typically removed from circulating red blood cells by the spleen. In the absence of the spleen, these nuclear remnants may persist in the blood. Their presence can be a sign of functional asplenia, lack of splenic function, and may increase the risk of certain infections, particularly by encapsulated bacteria. Target cells, also known as codocytes, are red blood cells with an appearance resembling a target or bullseye. They are a result of altered red blood cell membrane composition and can be more prevalent in the blood after splenectomy. Target cells are not usually associated with specific health problems but can be seen as a consequence of altered erythrocyte dynamics. Thrombocytosis, loss of sequestration and removal. The spleen plays a role in regulating platelet levels by sequestering and removing excess platelets from circulation. Following splenectomy, this regulation is disrupted, leading to an increased number of platelets in the bloodstream, a condition known as thrombocytosis. While mild thrombocytosis may not cause issues, severe cases can lead to an increased risk of thrombotic events. Lymphocytosis, loss of sequestration. Lymphocytosis refers to an elevated number of lymphocytes in the blood. After splenectomy, the spleen's ability to sequester lymphocytes is diminished, resulting in an increased lymphocyte count in circulation. This may not usually lead to clinical problems but is considered one of the post-splenectomy findings. It's important for individuals who have undergone splenectomy to be aware of these findings and to receive appropriate medical care and vaccinations to reduce the risk of infections, particularly those caused by encapsulated bacteria. Close medical monitoring and education on infection prevention measures are essential for the well-being of individuals with splenectomy to mitigate the potential risks associated with these post-splenectomy changes. The next section of this video consists of 20 USMLE Step 1-like questions about the topic that we just covered. Let's try them. Question 1. A 40-year-old patient presents with fatigue and recurrent infections following splenectomy performed several years ago. Blood smear examination reveals the presence of small, dark staining remnants of cell nuclei within red blood cells. Which of the following findings is most likely to be seen in this patient's blood? A. Howell-Jolly bodies. B. Heinz bodies. C. Our rods. D. Siderocytes. E. Spherocytes. The correct answer is A. Howell-Jolly bodies. Howell-Jolly bodies are small, dark staining nuclear remnants within red blood cells, and their presence is often associated with functional asplenia, such as after splenectomy. Patients with Howell-Jolly bodies are at increased risk of infections due to impaired removal of damaged or abnormal red blood cells. Question 2. A 25-year-old patient is brought to the emergency department following a motor vehicle accident with severe trauma. The patient sustained injuries to the abdomen, and a splenectomy was performed urgently to control bleeding. In the aftermath of the accident, the patient presents with ongoing fatigue and pallor. Concerned about the patient's condition, the emergency physician orders a complete blood count and peripheral blood smear to evaluate the blood cell morphology. On examination of the blood smear, red blood cells are observed to have a distinct bullseye appearance, with a central dark area surrounded by a lighter ring. What term best describes this finding? A. Howell-Jolly bodies. B. Oppenheimer bodies. C. Schistocytes. D. Target cells. E. Spherocytes. The correct answer is D. Target cells. Target cells, or codocytes, are red blood cells with a characteristic appearance resembling a target or bullseye. They can be seen in conditions like thalassemia and post-splenectomy states, both of which can occur in the context of trauma and splenectomy following severe abdominal injury. These altered red blood cell shapes are indicative of changes in membrane composition. Question 3. In the spleen's white pulp, a region known as the periarteriolar lymphatic sheath, PALS, is characterized by the presence of T cells. What is the primary role of the PALS in the immune function of the spleen? A. Production of antibodies. B. Blood filtration. C. Removal of damaged erythrocytes. D. Activation of B lymphocytes. E. Storage of platelets. The answer is D. Activation of B lymphocytes. The PALS in the spleen's white pulp is primarily responsible for the activation of B lymphocytes. T cells within the PALS play a crucial role in interacting with and activating B cells, initiating the immune response. This interaction is essential for antibody production and overall immune function in response to antigens encountered in the bloodstream. Question 4. A 28-year-old patient with a history of sickle cell disease presents with a sudden onset of severe abdominal pain, fever, and jaundice. Physical examination reveals splenomegaly. Laboratory tests show a markedly decreased hemoglobin level, elevated reticulocyte count, and an absolute absence of Howell-Jolly bodies on peripheral blood smear. Which of the following complications is most likely responsible for this presentation? A. Acute vaso-occlusive crisis. B. Parvovirus B19 infection. C. Aplastic crisis. D. Hemolytic crisis. E. Functional asplenia. The correct answer is C. Aplastic crisis. In patients with sickle cell disease, an aplastic crisis can occur due to infection with parvovirus B19, which selectively infects and destroys red blood cell precursors in the bone marrow. This can result in a sudden decrease in hemoglobin levels, leading to severe anemia, jaundice, and splenomegaly. The absence of Howell-Jolly bodies suggests functional asplenia, which is characteristic in sickle cell disease. Question 5. A 30-year-old patient with a history of a complicated splenectomy several years ago presents with an unexplained elevation in platelet count during routine blood tests. Despite being asymptomatic, the patient's primary care physician is concerned about the potential complications associated with this condition. On further investigation, the patient's platelet count is found to be significantly above the reference range. What term best describes this hematologic abnormality? A. Hypersplenism. B. Polycythemia. C. Thrombocytosis. D. Hemolytic anemia. E. Leukemoid reaction. The answer is C. Thrombocytosis. Thrombocytosis refers to an elevated platelet count in the blood, and it can occur as a result of splenectomy, where the regulation of platelet levels is disrupted. This condition is often asymptomatic but is associated with an increased risk of thrombotic events. Question 6. A 45-year-old patient presents with abdominal discomfort and is diagnosed with lymphoma involving the spleen. The histological examination reveals the presence of malignant B cells within the spleen's white pulp. Which of the following statements about the location of these malignant B cells is accurate? A. They are primarily found in the red pulp. B. They are located within the marginal zone. C. They form lymphoid follicles. D. They are isolated in the spleen's trabeculae. E. They reside in the spleen's central artery. The answer is C. They form lymphoid follicles. Malignant B cells in the spleen associated with lymphoma are typically found within the white pulp, where lymphoid follicles, consisting of B cells, are a characteristic feature. This organization is part of the spleen's immune function and is often disrupted in lymphoproliferative disorders such as lymphoma. Question 7. A 22-year-old patient with a history of sickle cell disease presents with recurrent infections. Blood tests show an elevated number of lymphocytes in the peripheral blood. What term best describes this condition? A. Lymphocytopenia. B. Leukocytosis. C. Eosinophilia. D. Lymphocytosis. E. Monocytosis. The answer is D. Lymphocytosis. Lymphocytosis is characterized by an increased number of lymphocytes in the peripheral blood. In individuals with splenic dysfunction, such as sickle cell disease with autosplenectomy, the spleen's ability to sequester lymphocytes is compromised, leading to lymphocytosis. Question 8. A 45-year-old patient presents with recurrent bacterial infections after undergoing splenectomy. Which of the following pathogens is the patient most susceptible to as a result of this condition? A. Tuberculosis. B. Staphylococcus aureus. C. Escherichia coli. D. Streptococcus pneumoniae. E. Candida albicans. The answer is D. Streptococcus pneumoniae. Patients who have undergone splenectomy or have splenic dysfunction are at increased risk of infections by encapsulated bacteria, including Streptococcus pneumoniae. These infections can lead to severe pneumococcal diseases, such as pneumonia and meningitis. Question 9. In the spleen, the marginal zone is a region located between the red pulp and white pulp. It contains specialized B cells and macrophages and serves as a critical site for the capture of blood-borne antigens by antigen-presenting cells, APCs. Which of the following functions is most characteristic of the marginal zone's role in the immune response? A. The primary site for B cell differentiation. B. Proliferation of T lymphocytes. C. Clearance of immune complexes. D. Erythrocyte filtration. E. Hematopoiesis. The answer is C. Clearance of immune complexes. The marginal zone in the spleen is known for its role in capturing blood-borne antigens and immune complexes, which are then presented to lymphocytes and removed from circulation. This function is essential for immune surveillance and the body's defense against pathogens and antigens in the bloodstream. Question 10. A 35-year-old patient with splenic dysfunction due to a medical condition is advised to receive vaccinations against encapsulated bacteria, including pneumococci, HIV, and meningococci. Which of the following encapsulated organisms is gram-negative and characterized by a polysaccharide capsule? A. Streptococcus pneumoniae. B. Listeria. C. Neisseria meningitidis. D. Staphylococcus aureus. E. E. coli. The answer is C. Neisseria meningitidis. Neisseria meningitidis is a gram-negative bacterium characterized by a polysaccharide capsule. It is one of the encapsulated organisms for which vaccination is recommended in individuals with splenic dysfunction to reduce the risk of meningococcal infections. Question 11. A 30-year-old patient with a history of sickle cell disease and autosplenectomy presents with signs of immune dysfunction and decreased complement activation. Which of the following laboratory tests is most appropriate for diagnosing complement deficiencies in this patient? A. Serum iron levels. B. Complement component 3, C3, levels. C. Erythrocyte sedimentation rate, ESR. D. Platelet count. E. Hemoglobin electrophoresis. The answer is B. Complement 3 levels. To diagnose complement deficiencies, including decreased C3 levels seen in patients with splenic dysfunction, measuring serum complement levels, specifically C3, is a standard diagnostic approach. This helps assess the patient's complement system function. Question 12. A 45-year-old patient with a history of splenectomy presents with recurrent bacterial infections and laboratory evidence of IM deficiency and decreased complement activation. What is the most appropriate management strategy to reduce the risk of infections in this patient? A. Administer antiviral medications. B. Provide corticosteroid therapy. C. Initiate antibiotic prophylaxis. C. Perform a repeat splenectomy. E. Prescribe antifungal drugs. The correct answer is C. Initiate antibiotic prophylaxis. In patients with splenic dysfunction and susceptibility to bacterial infections, especially by encapsulated bacteria, antibiotic prophylaxis is often recommended to reduce the risk of infections. This approach helps protect the patient against potential pathogens. Question 13. A 28-year-old patient with a history of splenectomy presents with recurrent bacterial infections. Further evaluation reveals decreased levels of C3b in the bloodstream. What is the most likely underlying cause of this C3b deficiency in this patient? A. Overactive B cell responses. B. Enhanced opsonization of pathogens. C. Impaired complement activation. D. Increased splenic sequestration of immune complexes. E. Elevated levels of IgG antibodies. The answer is C. Impaired complement activation. In the absence of the spleen, there can be impaired complement activation, leading to decreased levels of C3b. This deficiency can compromise the body's ability to effectively combat infections and clear immune complexes. Question 14. A 35-year-old patient with a history of sickle cell disease and autosplenectomy presents with signs of immune dysfunction. Which of the following mechanisms is most likely contributing to the immune dysfunction seen in this patient? A. Enhanced B cell activation. B. Elevated levels of IgA antibodies. C. Impaired complement activation. D. Decreased levels of IM antibodies. E. Increased T cell proliferation. The correct answer is D. Decreased levels of IgM antibodies. In patients with splenic dysfunction, such as sickle cell disease with autosplenectomy, IgM deficiency can occur. IgM antibodies play a critical role in complement activation and opsonization. Decreased levels of IgM can lead to impaired complement activation and increased susceptibility to infections. Question 15. A 50-year-old patient presents with recurrent infections after undergoing splenectomy due to trauma several years ago. Laboratory tests reveal decreased levels of IgM antibodies. What is the most likely consequence of this IgM deficiency in this patient? A. Increased resistance to bacterial infections. B. Decreased susceptibility to viral infections. C. Enhanced clearance of immune complexes. D. Impaired opsonization of pathogens. E. Elevated levels of C3b in the bloodstream. The correct answer is D. Impaired opsonization of pathogens. IgM antibodies are crucial for opsonization, which enhances the clearance of pathogens. In the absence of IgM, the patient is more susceptible to bacterial infections due to impaired opsonization. Choice E is not correct because it should be decreased levels of C3b in the bloodstream, not elevated. Question 16. A 38-year-old patient who has undergone splenectomy presents with signs of thrombocytosis on routine blood tests. Which of the following complications is most concerning in this patient? A. Hematuria. B. Thrombosis. C. Lymphadenopathy. D. Hemolysis. E. Splenomegaly. The correct answer is B. Thrombosis. Thrombocytosis, or an elevated platelet count, can increase the risk of thrombotic events in patients who have undergone splenectomy. Thrombosis is a serious complication that requires careful monitoring and management. Question 17. A 32-year-old patient with a history of recurrent infections and splenic dysfunction is administered a vaccine to reduce the risk of infections caused by encapsulated bacteria. Which of the following vaccines is most appropriate for this patient? A. Varicella vaccine. B. Hepatitis B vaccine. C. Human papillomavirus, HPV, vaccine. D. Meningococcal vaccine. E. Influenza vaccine. The answer is D. Meningococcal vaccine. Patients with splenic dysfunction are increased risk of infections by encapsulated bacteria like Neisseria meningitidis. Vaccination with a meningococcal vaccine is essential to reduce the risk of meningococcal diseases. Question 18. A 24-year-old patient presents with severe bacterial infections, including pneumonia and septicemia. Laboratory testing reveals elevated levels of IgM antibodies in the bloodstream. Which of the following conditions is most likely contributing to this presentation? A. Post-splenectomy. B. Thalassemia. C. Systemic lupus erythematosus. D. Celiac disease. E. Chronic myeloid leukemia. The answer is A. Post-splenectomy. Following splenectomy, patients are at increased risk of infections, especially by encapsulated bacteria. Elevated levels of IgM antibodies may be seen as part of the immune response to combat these infections. Question 19. A 35-year-old patient with a history of sickle cell disease is found to have an increased number of lymphoid follicles within the spleen. Which of the following cell types is most likely to predominate within these follicles? A. Neutrophils. B. Macrophages.
C. B cells. D. T cells.
E. Eosinophils.
The correct answer is C. B cells.
Lymphoid follicles within the spleen are typically composed of B cells, and they are an important part of the spleen's immune function. In conditions like sickle cell disease with autosplenectomy, these follicles may become more prominent, as the spleen plays a role in immune responses. Question 20. A 28-year-old patient with a history of splenectomy presents with recurrent infections and is found to have elevated levels of antibodies in the bloodstream. What is the most likely explanation for this finding? A. Impaired antibody production. B. Defective B cell activation. C. Decreased complement activation. D. Enhanced B cell proliferation. E. Reduced immune complex clearance. The correct answer is E. Reduced immune complex clearance. After splenectomy, one of the consequences is a reduction in the clearance of immune complexes and cellular debris. This can lead to the accumulation of antibodies in the bloodstream due to decreased removal of immune complexes by the spleen. Thank you for watching. More videos coming. Good luck with your studying and exam. Thank you so much for watching. Please watch other immunodeficiencies videos. And, please subscribe, comment, and like. Don't forget to share this video with your classmates. See you in the next video.